Thank you, first of all, for bringing to sit down with us. And how does it feel? You're here among so many other Black leaders and legislators, exchanging ideas. How empowering is that?
It's amazing. We all have our own state work that we're doing, our colleagues that we work with in our states, our own state politics. But every year that I come to NBCSL, I get to be surrounded by colleagues from all over the country. We all have different themes on the issues that deal with equity and advocating for our communities, but we're operating in different contexts and learn so much from each other. So I'm having a great experience.
Now, you moderated a session on prescription drugs.
Yes.
Tell us about that and why this session was so important.
Absolutely. I was really honored this morning to help convene a session that deals with health equity and reducing the cost of prescription drugs, which is something that's so important to me. I shared as part of the panel my own personal experience with my mother, who growing up, because she was self-employed, she operated a daycare out of our home, she didn't make enough money to be able to afford the private market when it comes to insurance, but she made too much for Medicaid. So growing up, we would get those letters in the mail saying you qualify for Medicaid, and we would get a letter months later saying you no longer have it. And seeing my mother work so hard and not have access to health care and prescription drugs and the things that she needed was just so painful growing up as a child. And so the issue of making sure that everyone in our communities are able to afford health care, whether it's the Affordable Care Act, but also the cost of prescription drugs, is so important.
So let's talk about that, because in 6 to 8 weeks, we are going to have a new administration that says that they want to roll back Obamacare, a new administration. We're not sure what's going to happen with prescription drugs. We've already seen the price of insulin has been capped.
Exactly.
Also negotiations that we've never seen on other drugs. And so connecting that to what you're doing on the state level, what are the challenges that you see ahead, and how can you meet those challenges within your state? And Maryland's a little different than other places.
Absolutely.
You know, so the further south we go, sometimes I'm a little bit like, oh, what's going to happen?
Right, yes. I think that we've been really fortunate in our country that the Biden-Harris administration has prioritized the cost of prescription drugs, even looking at insulin and other drugs to make sure that Medicare is actually negotiating. Those are the things that are at risk, and our communities will suffer if we see repeals in those gains that we have made. So in Maryland, we passed something called the Prescription Drug Affordability Board that literally looks at all the details on how drugs are priced. They prioritize certain drugs and do research to figure out if we need to make sure that there's a cap and an upper limit on how much those drugs cost to help reduce the cost for patients. We need more of those across the country, and we need to also just see it through so that consumers can have savings.
What are some of the other legislative priorities that you are working on?
Absolutely. One of them that I know you're familiar with is Eric's ID law. And that legislation really deals with individuals in our community who have invisible disabilities or developmental disabilities. It makes sure that we put on their state ID or driver's license a marker on there that shows to law enforcement officers, other first responders, that that individual has a disability that may be invisible, that they may not be able to respond to certain commands, that that officer or that person who's interacting with them can be made aware of that immediately and be able to make better decisions on how they interact with that individual.
Speaking on that piece of legislation specifically, because when I met Eric, met his mom, amazing, his story of saying the reason why this came about is because he was talking with some of his friends, and after seeing police shootings, they were scared about what was going to happen to them and his friends, who he himself is autistic. What do I do if I come across a police officer? And we just seen recently where there was an individual who had cerebral palsy, and he was also deaf. And the officers handcuffed him, threw him to the ground, beat on him, and didn't take time to figure out, while someone was yelling, he's deaf. Not taking that time out. That's so important. When it comes to that piece of legislation, is there any ground that you all have been able to gain? I know there have been talks happening.
Absolutely. We have been leaving no stone unturned when it comes to that bill. We've been meeting with members of the committee. That legislation has been introduced 2 times previously. We are working with various stakeholders.
What has been the issue with that bill?
The issue with the bill has been some concerns from communities that don't look like us, who have just raised everything under the sun, such as, what if that is a marker where someone's discriminated against because you can see that they have a disability? And we remind them that this is something that's optional. This is something that no one is required to utilize. It's another tool for public safety. It's another tool to make sure that our officers and first responders and people in the community are made aware, because an individual may not be able to communicate in the moment on their own. And so there have been a lack of understanding at times around what the needs are, particularly for Black men. Eric, as you know, he just turned 20 yesterday, actually. He's a 20-year-old Black man who is high functioning with autism.
But many are not.
Exactly.
And the numbers show that when it comes to Black and brown people who have invisible, any type of invisible handicap, that they are harassed more, that they're prosecuted more. And so this is just one of those issues that you have to bring race into the conversation.
You have to.
What is it that you want to leave with from this conference?
What I want to leave with is, one, just being able to connect with my colleagues across the state. When things happen at the federal level, when our communities are under attack, it's us at the state legislatures who are left to deal with the pieces. Whether it's communities that are being separated and deported, whether it's repeals on different protections when it comes to health care, we at the states have to find solutions to help fill those gaps. And so coming together with colleagues at this moment, at this time, is so important for us to figure out how we plan, how we protect our communities, and how we also are proactive around wins as well in this time.